All right, it looks like people have made it through the waiting room. Hello, good evening. My name is Grace Sullivan Zirkle. I use she, her pronouns, and I'm Associate Dean of Students and Director of New Student and Family Programs, which means it's my privilege to help welcome all of you to Duke and help you in your transition to learn about the institution, to create community, and to make Duke your home. I'm really excited that you all are here listening live or watching the recording for our third summer transition series of the summer. This is a series of webinars where we try to bring Duke experts to you to answer your questions in real time. Today, our topic is staying well in your first year. It is part one of two webinars on this topic, and in a minute, we'll have some campus partners who cover areas including immunizations, health insurance, nutrition, student health at large, to talk some, again, about their areas of expertise. But before we do that, I'm going to go over a few housekeeping items just about the Zoom in case this is your first STS you are joining. We would love if you could ask questions in the Q&A feature below. So if, as we're going through the presentation, questions arise, go ahead and put them in the Q&A chat. I might encourage you to wait until each speaker finishes just to make sure that they don't answer your question in their prepared remarks. But please ask questions. We want this to be interactive. After our presentation, we will open up the Q&A and get through as many questions as we possibly can in whatever time is left. Sometimes your responses might be typed. You might get a typed response. Other times we may ask live the panelists to answer some of the questions. We have disabled the chat, so if you need one of us, go ahead and put, again, that comment in the Q&A. And we are recording this webinar. So again, some of you are hearing this for the first time as a recording, but if you're not and you're here live, know that we will post this in about 48 hours on our website so that you can review it. If you didn't get down that note about a specific thing, you'll be able to access this later. So with that, I am excited to hand things over to my colleague, Dr. Hunter Spots.
Thank you, Grace. And I want to thank everyone for taking the time to be on this Zoom to familiarize yourselves with the services we provide. We have a lot of great information to go over. Pictured here is our building where we have student health at the corner of Tower View Road and Union Drive on West Campus. We're on the second floor from the street level, and on the third floor is our counseling and psychological services, who you'll hear from at another time. With me this evening is Jamie Rinker, one of our clinical dietitians, who will go over our nutrition services. We also have Ellen Crawford, who will be going over our immunization services and the immunization requirements. And yes, Duke, as well as the state of North Carolina, require certain immunizations for all students attending college in North Carolina. And then you'll hear from our Associate Director for Operations, Jill Farrington, who will talk about the insurance requirements and the processes surrounding insurance. So with that, Grace, if you go to the next slide. So just to give you an overview of location, I know many of you may not be yet familiar with the geography of the campus. East Campus is the star located on the right-hand side of the screen in black. West Campus is the blue star, and that's right where the chapel is located. Then we are located at the corner of Tower View and Union Drives. We also have the Duke Health Center and Duke Hospital on campus. The red star is the location of the emergency department, but that's also in the location of campus for the School of Medicine, the Duke outpatient specialty clinics, as well as the inpatient hospital. So we have a full range of medical services on campus. Student health serves as your primary care provider while you're a student. And we take care of all 20,000 students, both undergraduate and grad and professional students. Our primary care clinic is open during business hours during the week. We do also have 24/7 nurse advice with a phone number that's specific to students, as well as I said, the emergency room on campus and Duke Urgent Care's office is located in the vicinity. Move on to the next slide. So we provide a host of clinical services. As I said, we service the primary care medical clinic for all of our students. And this includes sports medicine as well as men's and women's health. You'll hear about nutrition in a couple of minutes. Um, we provide a full range of immunization services, so we can ensure that all students are fully immunized. And we also, for students who are on allergy shots, we have an allergy immunotherapy clinic. We have students traveling all over the world, and we provide travel medicine services for those students. It could be related to both personal or Duke-related travel. As I've mentioned, we have the nurse advice line that's in operation 24/7. And then on site, we have X-ray as well as lab services, including phlebotomy. And what's nice about the laboratory services as well, if you're still seeing a physician, whether it's your primary care physician or a specialist from home, and they would like to order labs for you while you're at Duke, there's a process that they can do direct ordering, and then we can transmit the results to them. And then we have telemedicine services as well. There's a number of visits we can do by video visit. And one of the things that I encourage all students to take advantage of is beginning in September, we can schedule students for welcome to student health video visits. And what this enables us to do is without needing to come to the clinic, you can schedule a video visit with one of our medical providers. It's a way to get to know one of our medical providers, to update your chart and get some essential information into your chart so that perhaps the first time you really have a more urgent need, you will have already engaged with us and it's not anything that's new to you and you already have a familiar face in one of our medical providers to see. Go to the next slide, please. And included in our staff are board certified family physicians. I'm board certified in family medicine, including 5 other of my colleagues pictured here. We hold faculty appointments with the School of Medicine and Duke's Family Medicine and Community Health. In addition to myself, Dr. Fan Zhou has a special interest in quality improvement. Dr. Melanie Trost sees a lot of students for eating disorders and other women's health issues. Tiffany Kovas also helps provide many women's health services. Dr. David Lobach is an endocrinologist who comes to our clinic. He sees many of our students who have type 1 diabetes. And then Dr. Kenzie Johnston, in addition to duties serving as a team physician for a couple of our varsity athletic teams, sees patients in our clinic as well for a wide range of sports-related issues. Next slide, please. As I mentioned, we have the hospital as well as the specialty medical clinics right on campus. So we do have access to specialist medical services on campus. We can provide referrals for those services. Also, if you know you will already be needing those specialty services, you should consider consulting with your local either primary care physician or treating specialist. They can go ahead and make those referrals now before you arrive on campus in August to expedite your appointment. Like many specialty services, sometimes there is a wait to get in for appointments. So it's a good idea if you already know you're going to need specialty services to get that ball rolling with the referral from your home primary care physician or specialist. But we can also provide that referral once you come to campus if needed. And also as issues arise, we can refer students for specialties medical services. As I said, we are a primary care clinic. We don't operate as an urgent care or emergency department. And so we do our visits by appointment, and there's multiple ways you can schedule. We do have some appointments available through your Duke MyChart account, which you'll establish once you get here. And so we have those online appointments available, but also you can call our office and schedule the appointment. And we also reserve a number of same day appointments so that if you have an issue that you want to be seen same day, you can call and talk with one of our nurses about a same day appointment. Again, the phone number here, 919-681-9355, is the same number that you can use to schedule during the day, but also receive after hours nurse advice. We just want to keep it simple with that one phone number. Okay. And with that, I'm going to hand it over to our clinical dietitian, Jamie Rinker, who's going to tell us a little bit about our nutrition services.
Thank you, Dr. Spots. I'm so happy to be here tonight. I will be one of your campus dietitians, and I want to share with you why you might want to come and see me. So at Duke Student Health, we really encourage all of our students to be curious and engaged with their health and wellness. And so I invite all students to come and meet with one of our dietitians. And the reason we want to do that is so that we're supporting all students that have medical nutrition related um, needs that will be met and that we can work together to help you figure that out. But then also to support all students that are interested in any part of their health that has to do with nutrition. So this is a free of charge included in your healthcare fee. There's no extra charge to come and see a dietitian. So there's no reason not to do it because you might be curious about where to get vitamin A. And you may not be, but you might want to make sure that you're not eating way too much protein, things like that. Like some of the conversations I have with the students are focused on general health and exercise performance or exploring all of our food options on campus. But also, I talk with people about body image and healthy eating habits and how to really set yourself up for success well into your adulthood. So, I really invite you all to come and see me. Remember, nutrition counseling sessions are included in your healthcare fee. And we also have some really great information on our website in this Fuel to Flourish page that you'll see when you look at the student health webpage. You can get to us, and there are recipes and lots of interesting things about nutrition. So I welcome you and can't wait to meet you all this fall.
Okay, and then we're just reiterating that we have one phone number, one stop shop phone number for contacting us. Um, For medical emergencies, it would just be like from at home. You would here in the United States, it would call 911. And then in addition to the on-campus emergency department, there are uh, Duke urgent care locations in the vicinity of campus. Next slide. And with that, I'm going to turn it over to Ellen Crawford, who manages our immunizations and immunization compliance.
Thank you, Dr. Spots. Welcome to everyone. Thanks for taking the time to sit and listen to all of our services at Student Health. We're looking forward to having you all here in the fall. I want to talk a little bit about immunization compliance, why we do it, why it's important, and the process behind it. We recognize that it can certainly be a little bit confusing and overwhelming. So hopefully we'll get some of your questions answered during this webinar. If you still have questions at the end, please feel free to reach out to us at our email address, which is immunizations@duke.edu, which you will find on the screen. Why do we do immunization compliance? It is a state law, as Dr. Spots mentioned. The state of North Carolina requires that all incoming college students show proof of certain vaccines or immunity to certain diseases by the 30th day of class to stay enrolled. Now, one thing it is important to mention is that every state has different requirements. So if you're coming from a state outside of North Carolina, if you're coming from a country outside of the United States, you may have met the requirements for that state or for your country or for your home country, but that does not mean that you've met the requirements for the state of North Carolina. So that is one thing that sometimes students do submit records and their pediatricians from home will tell them they're up to date. And we may respond and let you know that you need maybe one more vaccine, and that is because it is state law. we ask that you submit your records by June 15th. Now, the good news is that all of the undergraduate students, as today, have access to their student health gateways. Thank you for being patient with our system. You should be able to get into your gateway today and upload your records there. We ask that you submit your records by June 15th. This is not the deadline to complete the immunization requirements. It's simply the deadline to submit your records. This gives our staff time to process all the records that we have, communicate back to you as to any requirements you may be missing, and then that will give you time at home to finish any necessary requirements. You have until the 30th day of class to officially complete your requirements. By state law, if you have not finished those requirements by the 30th day of class, the Duke can remove you from class. So we really want you to act as much as you can during the summer to complete all of the requirements so that once you get to Duke, that is something you can put behind you and just focus on getting settled. So again, two deadlines. The first deadline is to submit your records, which is coming up, which is June 15th. And the second deadline is when you have to have everything completed, which is September 22nd. Now, on our website, you will find the steps for immunization compliance, which we have listed on the screen here. And that includes all the links to all of the requirement forms that you will need. The immunization requirement forms are under step 4, and as undergraduate first-year students, you'll be clicking on that first link that says immunization requirements for undergraduate students. In step 1, Duke also asks for all incoming students to complete the tuberculosis screening questionnaire. This is a questionnaire that you will complete online. After you submit it, you will get an email to the email address that you submitted your questionnaire from, and that email will contain a PDF. You will then need to submit that PDF to us on your gateway along with your immunization records. Just follow the instructions on the TB screening questionnaire, and based on any risk factors you may have, the questionnaire will trigger you as to whether or not you need TB testing to come to Duke. If you do need TB testing, it must be done in the United States, and it must be dated on or after March 1st of 2026. Next slide, please. This is just a picture of what our undergraduate immunization form looks like. I do want to point out a few things of importance. It's super important that the top of this form be completed with your full name and your date of birth. We like for your Duke Unique ID number to be on the form as well. And this is a 7-digit number that starts with a 0 or a 1. You can find it on the profile page of your Duke Hub account. If you cannot find that number, it's okay. Please submit your records. Just be sure your full name and date of birth are on it. The bottom of the form does need to be completed by your primary care provider. It can be signed by anyone with the initials that are on the bottom of the form. This can be an MD, MBBS, a nurse practitioner, an RN, a physician assistant, or an LPN. Please make sure that your physician or your provider signs the bottom of the form and dates the bottom of the form and includes a stamp or an address and phone number of the office. The form contains 2 sections. The top section, Section A, are the required vaccines, and Section B are the optional vaccines. Section A are the vaccines that are required by the state of North Carolina. Section B are any vaccines that you may have received that are not considered required, but that you would like to have added to your student health record. These vaccines are nice for us to have so we can have kind of a complete overview of you so that if you do come in to see our providers for other reasons, we can kind of know what you have been vaccinated against. It also helps us if you come in to have a travel appointment. Does your information need to be submitted on Duke's immunization form? We prefer that it be submitted on the form. It just makes the process go more smoothly for everyone. If you're having challenges getting your form signed by your provider, we will certainly accept outside forms from perhaps the health department, from your state immunization registry, Some of the providers' offices prefer not to sign the form, but to give you an official printout of your immunization records. Those are all acceptable forms of submission. Just be sure that anything you submit to us does contain your full name and your date of birth. All the immunization records must also be in English. And be sure if you're coming from an outside country that your full name, again, and date of birth in English are on your vaccine records. If you're not able to find your records, there's a few things we can do. The state of North Carolina does allow us to draw blood titers to prove immunity to measles, mumps, rubella, and varicella, which is chickenpox. You can have your blood drawn to prove immunity, and you can submit the actual lab reports to us. The state of North Carolina does not allow us to have blood draws to prove immunity to tetanus and hepatitis B. If you do not have records for those vaccines, you will need to start those vaccine series again. We certainly understand that for tetanus, it's a 3-dose vaccine series. For hepatitis B, it's either a 2 or 3-dose vaccine series, depending on the brand. We understand if you have to restart those, that you may not be able to get all of the vaccines completed before your arrival. We encourage you to follow the vaccine schedule, submit the records that you have received prior to coming to Duke, and then we will assist you with any future vaccines that you need while you're on campus at the appropriate time here at Student Health. If you are missing vaccines, so once you submit your records and you hear back from us that you may be missing a vaccine, where can you get those vaccines? You can go to your PCP, your medical provider. Many of the local pharmacies will administer the vaccines that are required by our state. Some of the local health departments will also do this. If you are starting in the fall, you are eligible to be seen at Student Health after August 1st. So if you do receive an immunization at your PCP or local pharmacy or any place outside of Student Health, be sure that you submit the documentation to us. You can add the date to your Student Health Gateway, but we need the actual documentation that you have received the vaccine so that we can verify that date and give you credit for it. Again, the deadline to complete these requirements for the fall semester is September 22nd. We highly encourage you to try to finish all of the requirements, as many as you can, before you arrive. We certainly understand, especially for some of our international students, that you may not have access to the required vaccines or the TB testing. We will help you fulfill those requirements when you get to Duke. But if you do have an opportunity to complete them at home before your arrival, it will make your life so much easier, and you can just focus on getting settled in Durham and enjoying your orientation experiences. Once you find your records, how do you submit them? We encourage you again to go to our website and to follow the instructions. There are links there that will take you directly to your Student Health Gateway. You will click on the medical clearances button, which we have some slides to show you what these look like. You'll click on that medical clearances button, and that will take you to the next slide, which looks like this. You will add all of the dates under each of the vaccines, and then at the very bottom of this page where it says Immunization Recs Form, that green button is where you will upload all of your documents. You will also upload any future documents to that same spot. After you submit your records, and one thing I do want to mention because it can be very confusing. When you first upload your records and enter your dates, some of the clearances on your portal will say awaiting review, some of them will say no data, and some of them will say not met or not compliant. Please know that those clearances will change once our staff reviews your records. This is just the way the system is programmed. So once you submit your records, give us about 7 to 10 business days, and our staff will review your records. Once they are reviewed, you will receive a secure message on your Student Health Gateway notifying you of your immunization compliance status. We will either let you know that you have completed all the requirements or let you know if you're missing something. And how that works is that you will receive an email to your Duke email account letting you know that we have sent a message to your Student Health Gateway. We communicate through the Student Health Gateway because it is secure and it contains your medical information. So be sure to always monitor your Duke email. You're going to be getting a lot of important information all summer, not only from the immunization and the insurance departments, but from a lot of areas across campus. So start monitoring your Duke email. And if you do see a message from Student Health, please follow through, click on that link, and read the message. That will then put you in communication with the staff member who processed your record. So if you have any questions about the message that you received, you can contact that that staff member directly. And if you have any other questions after that, you can always email us at immunizations@duke.edu. So I was speaking earlier about some of you who may need to restart vaccine series, or you may be in the middle of a vaccine series, and you may not have time to complete all of the vaccines before you arrive at Duke. That's okay. We will make you what we call partially compliant in our system, which means that we know that you're waiting the appropriate time frame to receive your next vaccine. It's really important not to receive the vaccines before the times that are required by the vaccine companies. So if you are in partial compliance, you will be allowed to attend classes and attend all the activities. We will send you reminders on your Student Health Gateway about when that next vaccine is due. And then at that time, you can schedule an appointment with us at Student Health and come in and complete your requirements. So we do have some immunization clinics in August that we're working on. We're going to be here at our student health facility from August 10th to August 14th. You will be getting some more details about this immunization clinic later in the summer. But for those of you who are not able to fulfill all of your requirements before you get here, we will be available to you that week to come to Student Health to get what you need. We realize that on the second week that's on the screen that you guys will be in your orientation experiences. So if you're not able to visit us August 10th through August 14th, when you get back from your experiences, you can schedule an appointment with us at Student Health, and that would be a direct appointment with our immunization nurse. And you can do that by just calling our main number, which is 919-681-9355, option 2. There is parking at the Bryan Center, which is close to us at 136 Science Drive. And again, we'll be sharing more information about the immunization clinic later in the summer. And again, welcome, and please reach out if you have any questions about the immunization process. And at this time, I would like to turn it over to Jill Farrington so she can speak with you about insurance.
Hello, everyone. Thank you for joining us today. My name is Jill Farrington. I am the Associate Director for Clinic Operations for Student Health and Student Health Insurance. Next slide. First, we want to start off letting everyone know that Duke does require all students to have insurance. You can either enroll in our student medical insurance plan, or you have the option to submit a waiver if you already have comparable coverage. This is important because we know that accidents happen and illnesses happen, and we want to ensure that all students have adequate health insurance while they are in Durham, and we want to make sure that we keep the cost of medical expenses down for our students. Things to know, our insurance plan begins every year on August 1st, and it runs through July 31st. That is the full plan year. This year, our insurance will be through Aetna Health Insurance, and our premium for students is $4,290. That is for the entire plan year. Our dental insurance premium is $383, and dental is optional for students. We do not require that our students opt into dental, but it is available to our students. Here is just a brief overview on the Aetna plan highlights. This information, along with detailed benefit information, will be on our website. We are working actively to get that up for all of our students and parents to take a look at. But this is just the basic plan highlights for the Aetna plan. It's important to note that, we do not have deductible for individuals as long as you stay within the Duke Health and Wake Med network. And you can see the physician office copays, urgent care, and the outpatient mental health copays. It's important to note for students that you will pay a health fee each semester. That health fee gives you access to the wellness building and the services at Student Health and CAPS. Therefore, you will not pay a copay when you come to Student Health. That is covered under your health fee. As we mentioned, either you have to opt into our insurance or you have the option to request a waiver. This is our waiver criteria. So we can read through these, but most importantly to note that if you are a F1 or a J1 visa holding student, you are unable to opt out or request a waiver for insurance, and you will be automatically enrolled into our insurance. The waiver criteria is very strict. If you're going to request a waiver, make sure that you have a front and back copy of your insurance card, and you will have to upload that into the system. We work with Gallagher as our vendor. You will upload your insurance card front and back to their system, and it will run it real time. And we have safeguards built in. It will be able to tell you instantly if your insurance passes or not. If it does not pass the waiver process, you will receive information to your Duke email, and it will either ask for more information or it will tell you why it did not pass the waiver criteria. Starting next week, you will receive information from Student Health as well as Gallagher, and the waiver system will be open. It will open on June 10th. Um, you will have more information on how to make it to the Gallagher Student Health. You can click on that link. It will take you there, and you will be able to submit or enroll in the insurance, submit a waiver or enroll. Okay, our waiver period. Generally, it's mid-June. Typically in the past, it was around June 15th. However, the portal will open next week on June 10th. All waivers and enrollment must be completed by September 15th. That's very, very important. All waivers and enrollment must be completed by September 15th. So we have about 3-4 months almost for folks to decide if they will enroll in our plan, or if you want to submit a waiver. Keep in mind, as Ellen said earlier, all communication from the insurance team will go directly to your Duke account email. So make sure that you're keeping an eye on your Duke account. If we have any questions or if we need more information, everything will go to that account. So make sure you're checking that. All right, here are some of our resources. As I stated, the insurance portal will open on next week, but here we have our insurance page on the Duke Student Health website, and we have the QR code here. You can scan it. It'll take you directly to our page. What's good about this is we have a very, very advanced frequently asked questions section on insurance. There are probably close to 100 questions there. You can go and you can search just about everything that you want to learn about our insurance. On the next side is our Gallagher Student Portal. And once you go to that Gallagher Student Portal, you will be able to go there and enroll in the student insurance, or this is where you would request a waiver. You will also be able to enroll in the dental plan in the Gallagher portal as well. All right, I just want to reiterate that we do have open enrollment beginning next week. You will have until September 15th to enroll in the insurance or to submit a waiver. Make sure that you are looking at your Duke email because that's where we will send information to you. Also, just know that you are not alone in this. Insurance is confusing and we go through it every day and it's confusing to us. So do not be afraid to contact our staff here at Student Health and ask questions if you have questions or if you need to navigate the system. We are here for you. You can walk in, you can email, or you can call us. Once again, welcome to Duke, and we are excited to help you.
Thank you, Jill, and again, I appreciate everyone for joining this call and getting to know our services. And again, as the previous slide showed, the reminder of the Welcome to Student Health video visits beginning in September. So I do encourage everyone to schedule one of those and get to know one of our medical providers.
Thank you all so much for sharing all of that really important and detailed information. This is our time for Q&A. So for our students listening live, if you have questions that you've not submitted yet, this is the time to do it. We will take questions as long as we can and we have questions, but I want to make sure that if you're on here, you're getting an answer if we have got the time for it. So I'm going to sling out some of these questions to our panelists and I will let you all decide who should answer which ones. A student said, I have tried to submit my information for my Duke MyChart, but it says the information I've provided is not found. Who can I contact for help?
That's a great question. So you may not be able to set up your Duke MyChart right away. We have to ensure that records are pushed over from the registrar's office to Epic. And then once you come to Student Health and have a visit with us, we will be able to help you set up your Duke MyChart. So it's just a matter of waiting until you get on campus and come into Student Health, and we will be able to give you a link to help you get set up on your MyChart.
Great.
And that can be done through one of the Welcome to Student Health video visits as well.
Wonderful. There's a few specific ones about immunizations. I think there's also a general answer that might help a lot of people. So one person says, my vaccination status says awaiting review, but for one specific entry, it shows not satisfied. Is there a specific reason it might have some combination of satisfied and under review?
The best answer is that it is just a system glitch. So I hate to say that, but the way that the system is set up, and we are working with our IT department to try to correct it because we understand that it is super confusing. But when you first initially submit your records, some of the requirements do say awaiting review, and specifically hepatitis B, if that's the one you're speaking to, will say not compliant. And the TB screening questionnaire typically says no data. So there's nothing that you have done wrong. It's just a system problem. So just be patient. As soon as our staff reviews your records, those clearances will change and we'll send you a message. So I would encourage you not to pay attention when you enter the dates as to whether or not things are switching to compliant. Just wait until you get a response from our staff. Like I said, we try to get that done within a few days. We ask that you be patient with us, and some at the high peak times it takes about 7 to 10 days.
Ellen, I just want to clarify, is that also the case if it says not compliant? If it says not compliant, could that ever not be true? Do they still need to wait for you all to
I
email?
would say to wait until you hear from us. Now, if you hear from us that you have not met the tetanus requirements, then that does mean that that is true. So, but wait and hear from the staff member. Watch your messages, and the staff member will let you know exactly what your compliance status is.
Great. And then a top question right now, given that immunization records are due right around the corner, can you remind us how they submit the immunization records? Where do they
Sure.
go?
Sure. And again, I know some of you have been trying for several weeks and you have not had access to the Student Health Gateway. You now do have access to the Student Health Gateway. So you're going to want to go to our website, and you'll find the link to take you directly to your gateway. And on that, you'll click on the medical clearances section. You'll enter the dates of your vaccines, and then you will upload your immunization records to the system at the bottom of the screen where it says Immunization Recs Form, the update button.
Wonderful. Where on campus could a student collect medications if they're prescribed to them? Is there a way for them to get those on campus?
So we do have a pharmacy in the student wellness building. I'm assuming they're referring to prescriptions, the medications that have been prescribed. So in the wellness building, there is a Duke campus pharmacy. There's actually another uh, pharmacy on the Duke campus and on the medical side. And then we can also when we prescribe medications, we can send them to whatever pharmacy a student chooses. So some students who live off campus would like to have their prescriptions sent to an off-campus pharmacy. So it's really up to the student where they would like it to be sent, whether it's to the on-campus pharmacy that's in our building, or if there's something more convenient to them off campus, we're happy to do that as well.
Wonderful. Um, hold on. Okay. So for a student that does physical therapy, maybe temporary, maybe long term, but they need to continue when they come to school here in Durham, how does that process work of switching over to a Duke healthcare provider physical therapist?
There is a physical therapy office in the wellness building. I should have mentioned that at the front end of the presentation. And again, there are other physical therapy offices, both Duke and not related to Duke in the vicinity. Um, Typically, the either you could either do one of two things. The medical provider you're already seeing can still make that referral in a lot of cases, or if that's not doable, you can come and see us and see one of our medical providers, and they can make the referral.
Great. There's a question about dental insurance in particular. What does the dental premium plan include, and how can a student assess whether they need it or not?
So the dental premium is $383, and that is for the entire plan year. That includes your cleanings, the basic cleanings and screening for your dental, and the max is $2,000. So I think that, it is beneficial. We also have a third-party dental office in the wellness center. So that's very convenient for students as well. And they do take the dental insurance that we have.
Great. Someone's asking, is a TB test and an X-ray from last summer acceptable?
So the TB screening questionnaire must be completed by all the incoming students. And when you answer those questions, if the questionnaire triggers you that you need to have a TB test, we require that the TB test be dated on or after March 1st, 2026, and it does need to be done in the United States. A chest x-ray does not take the place of a TB test. If you have a history of a positive TB test, then certainly reach out to us. That's when we would ask you to get a chest x-ray. But the TB testing does have to be dated on or after March 1st of 2026.
Ellen, can you synthesize again? There's a lot of information we've presented. So if someone is just thinking about I've got a doctor's appointment coming up soon. What are the forms I need to get signed? Yeah, can you synthesize that?
Sure. So if you have something coming up soon, the best place to go with that is to download our immunization form on our website, the immunization form for undergrads. Take that to your provider, have them review it with you, fill it out, and be sure they sign the bottom of it, sign and date the bottom of it. Again, if they do not want to sign this form for you, but will present you with an official immunization record, we will accept that as well. The TB screening questionnaire form, if you do not need any TB testing done, you can just simply submit the form. If you do need TB testing done, there is a place at the bottom of the form that asks for a provider's signature. I will tell you, if you want to submit your form without the provider's signature and then submit your TB testing separately, that is acceptable.
Great.
But the immunization form does need a provider signature.
You mentioned TB, which is a great segue. This is an international student who's specifically saying, can you confirm that I can have my TB test done at Duke, and when would that be?
Absolutely. Any vaccines or TB testing that you cannot get done in your home country, we will give you the opportunity to complete it when you arrive at Duke. We will have the immunization clinic set up the week before you start on your orientation week. We will be set up at Student Health and we will get you information with more details about those clinics later in the summer. If you don't arrive in time for that week, that's okay. Enjoy your orientation experience. And when you get back from that, call Student Health and we will get you an appointment with our immunization nurse to complete any of the required vaccines and the TB testing.
Great. I'm going to keep going with immunizations because we've got a few more, Ellen. Another question about the compliant error. So it says that I'm compliant for polio, but I haven't submitted anything yet. What do I do?
That's a great question. So polio is only required if you are under the age of 18. So the system knows those of you who are not 17 and will automatically make you compliant for that requirement. So again, try not to worry too much about those compliance statuses when you're filling out your forms and submitting your records. Submit them to us and let us take care of the work, and then we will send you the message for that. But yes, the polio is only required if you are under the age of 18. So it has converted to compliant for those of you who have already turned 18.
Great. A question about a chest x-ray. I think it could be interpreted two different ways. Do I submit the chest x-ray if I've already completed one, or maybe if I've already completed my forms, do I still submit the chest x-ray?
The chest x-ray will only be of value if you have a history of a positive TB test, meaning you have had a TB test in the past that the physician then said you need a chest x-ray to follow up with this. If you have a positive TB test in the past, we will need documentation of that positive test and documentation of your chest x-ray. If you're not sure what to submit, feel free to submit it. And then as we review your records, we'll be able to help you navigate what requirements you have met and what requirements you have not met.
Great. A student writes that in the Blue Book, we ask for all completed forms to be emailed to SHS medical records at dm.duke.edu. Can you elaborate on this?
That would not be the immunization form. So thank you for pointing that out. And we will look at that in the Blue Book and get that corrected and get that clarified. We do need you to submit your immunization records to your Student Health Gateway. That is how they are placed in the queue for processing. If your provider is submitting the records, they typically will want to fax the records themselves, and the fax number is on the bottom of our immunization form. But again, the quickest way for you to get your records processed is to upload them to the immunization gateway yourself. And again, thank you for that. We will look into that statement on the Blue Book.
Dr. Spots, you can correct me if I'm wrong, but I think this question leads into another one, which is that there are some non-immunization records that a student might want to submit to Student Health, which I think is what that other email is for.
Yeah.
A student is asking to follow up on it about the consent for treatment, for example.
Okay. Well, the consent to treatment is a Duke form that you would complete before going to any Duke Health clinic. So it's a health system form. We put it out there to complete ahead of time, mostly so that when you come to our clinic for the first time, it saves some time that you would complete it then. So one way or the other, it's going to be before your first medical visit that will need to be completed. So by putting it with the other items to complete, it's a time saver really just to go ahead and get it done. If you don't do it ahead of time, then when you come to your first visit, we'll ask you to complete it then.
Great.
And then with regard to the email for medical records, there are times when students might want to give us some medical records, past medical records, separate from the immunization records, maybe because you have a medical condition and you're going to be seeing one of our clinicians. So that would be the email address for submitting those medical records.
Great. On the topic of additional forms, if a student is a minor right now, but they won't be when they start at Duke, do they need to submit the minor consent form for student health?
They do not. If you're going to turn 18 by the time you arrive at Duke, then you're an adult and you do not need to sign it.
Great. To students that are listening, this is your last chance. We're almost done with the questions that are submitted, and so this is your last chance if you want to submit a question. But back to Ellen, we're going to clarify some TB. So just to clarify, an international student who once had TB test positive history, but they can't access the TB test, they can get it when they're here, even if they've had it in the past. They can get the immunization or the test once they're here.
That's a great question. Yes, if you are an international student and have a history, have a positive TB test, but you do not have that documentation, we will test you again when you arrive. If you do have that documentation, we will accept that positive test from your home country, and then we will just ask you to do a chest x-ray when you arrive. So all the TB testing and chest x-rays do need to be done in the United States. Again, if you do not have that document, that's okay. We'll just test you again when you arrive. And if you are positive, we will continue here. We can do your chest x-ray here at Student Health.
Wonderful.
And just in looking at the questions, I see there have been a number of questions from students who have identified themselves as international students, and I just want to say that the U.S. healthcare system is likely new to you. It is confusing, and we're here to help you get through that, help you navigate it. The insurance is likely new to you and can be confusing as well. So just please, reach out to us as you continue to have questions, including once you get here. We're here to help.
Amazing. A wonderful place to end. That's the end of the questions that have been submitted. So everyone should have heard a response either live or received a chat back. I just want to echo my thanks to all of our panelists for their time this evening, but also the care that you provide for our students year round. And I know we have more staff members that have been behind the scenes helping during this webinar. So thank you so much to all of you for supporting our students through the transition. For our students listening, again, this has been recorded and it will post it online in about 48 hours in the same place that you registered for the webinar. So if you want to review and listen back to some of these answers, please feel free to use the recording as a resource. We hope that you will tune into future summer transition series and have found this valuable. Our next one is next week on June 9th at 4 p.m. and it's our Trinity advising session. So if you are a Trinity College student, we would highly recommend that you tune in to that summer transition series. With that, thank you again for listening in. We appreciate your time and have a great evening.